Liberian government bureaucrats in rural areas who were just trying to make water safe are now leading burial teams to try and contain the Ebola crisis, because Ebola is spread at the end when people are dying. That's when they're the most contagious, is that moment of death. And so all of those government partners went from I'm testing water to make sure that it's clean, to I have to figure out how to safely bury these people rapidly. And so we had to make that call as an organization to switch over and say, we're not a little water program anymore. Do we want to leave or do we want to stay? If we want to stay, what are we going to do? And how are we going to turn this into an emergency response program?
All right. Welcome back to Unsung Americans. Thanks again for joining us. In our podcast, we share stories from frontline aid workers to show everyday Americans what foreign aid work really looked like on the ground, minus all the politics, bureaucracy, and nonsense. Please hit the like button and subscribe and share, especially with your skeptical friends and family. Today, I have a very interesting guest who has done a lot of very cool stuff overseas, and in particular was what I would describe as tip of the spear in preventing a mass global Ebola outbreak. So when we talk about unsung Americans, I think, at least in my opinion, our guest today is very much one of those unsung Americans. So anyhow, without further ado, Brett, can I just have you introduce yourself, and maybe just tell us where you're from, and from maybe sort of a personal standpoint, how you ended up getting involved in this type of work.
Sure. Hi, Alex. I'm Brett Sedgewick. I am, I'm from New Jersey and come from a long line of really service-oriented Americans. And I think as a kid growing up in the 80s, it really felt like America was the richest, most powerful country in the history of the world. And I had that perspective, and also thought, what can I be doing to provide service to the rest of the world? And that's it took me a while to find this space, but eventually I did, and realized I was really committed to it.
That's cool. Look, you and I overlapped actually for a short period of time early on in both of our careers, but I think especially for me, it was the very beginning of when I started doing this kind of work, and we were both working on Afghanistan projects at the time, which I think you probably know this, but several people that I've had on, we've talked about some of that work. So not that we need to go into it here, but otherwise, I think I'm sure we crossed paths at certain points, whether it was at a bar or event or something in DC, but still quite, it's been a long time. One of the reasons we got reconnected, I'll say, is that I had remembered seeing you, and it was either a newspaper article or someone had a post up that was showing you, I think, either going into or coming out of quarantine following some very intense frontline work to contain the Ebola outbreak would that have been 2016? Is that when?
It would have been 14, 15.
14, 15.
Yeah.
2014, 15. So that's a few years before the world dealt with a pandemic that wasn't contained, right? So unfortunately, but anyhow, maybe we can get right into that if it's okay with you. How did you, what kind of led to you getting involved? And then we'll get into the kind of nitty gritty, exactly what you were doing. How did we prevent it? Who actually prevented it? But how did you end up in that position to be on the front, really on the front lines, working to prevent the outbreak from spreading?
Sure. Yeah. I can kind of, I can take a step back and go to what set me up to be there. So my wife and I had worked in Liberia back in 2011, 2010. I was the country director for a NGO, and one of the programs that we set up was a water and sanitation program, trying to work with the government of Liberia to set up infrastructure kind of in the rural areas for the government to have systems to make sure that people were basically like drinking safe water and having like reasonably safe um, toilets and latrines. And, this is something that we take for granted, but leads to a lot of babies dying from drinking dirty water. And so if you're really trying to like bring down child death, like water is a huge issue. And getting the government to own that is also really important. So that's what we were setting up. And then we moved away for a couple of years, had some other adventures, and then decided to kind of move back to Washington, D.C. and settle down a little bit and have a family. When I did so, as I was kind of getting settled in D.C. and getting like, I went back to the same organization, but with a D.C. based job. And around then is when the first signs of the crisis started to show up. And, people might forget that Ebola for a long time was more of like a Central East African thing that would pop up and then get contained. And it hadn't really been in West Africa before. So and Liberia is like pretty far west and
Right.
had no idea what it was or how to manage it. And so it started to flare up, and I had handed off that program a long time ago, but still knew all the people in Liberia, and the leadership there, the government partners, and so I had a sense of how it worked in the rural areas, how the government worked, and so we started to support that, and very quickly it got out of control, and cases started really rising to be, tens, hundreds of cases. And it's really scary. So first, I think the Peace Corps decided to evacuate. And as soon as that happened, probably 75-80% of NGOs started to evacuate, and everybody started running. And that's when we got on the phone and said, okay, we have this infrastructure. Like we've been supporting the government in the rural areas on kind of sanitation issues. What's our role here? And we realized that all of those partners that we had been engaging with over the years and supporting, all of those like government bureaucrats, like Liberian government bureaucrats in rural areas who were just trying to like make water safe, are now leading burial teams to try and contain the Ebola crisis, because Ebola is spread at the end when people are dying, and that's when they're most contagious, is that like moment of death. And so all of those government partners went from like, oh, I'm testing water to make sure that it's clean, to like, I have to figure out how to safely bury these people and rapidly. And so we had to like make that call as an organization to switch over and say, we're not like a little water program anymore. Do we want to leave or do we want to stay? If we want to stay, what are we going to do? And how are we going to turn this into an emergency response program? Any questions? Do you want me to keep going? I know I've been like talking about
any questions. I have plenty that I'll come back to. I just think just the brief comment or something to draw attention to is how crazy, not crazy as in someone made a bad decision. It's not about that. The idea that these folks who were, as you kind of, you put it well, they were just testing water, and they went from that to suddenly having to figure out how to bury a bunch of people who died on a like large scale death and tragic death. It's just kind of I think I don't know. I'm not sure I could come up with a comparison to that, or I have no comparison to that myself. I don't think most people do either, right?
Yeah, I agree. I mean, I do think that like early COVID, when everyone was like all of a sudden just like my entire life and job and conception of like how I'm living my life is going to change very, very quickly, or is changing very, very quickly. And how scary it was and how like low information it was. Like,
yeah,
what are we actually, what is that? What are we actually trying to do here? I think that probably, I think the thing about the difference with Ebola is like if you get it, the likelihood, especially when there were not high quality treatments, if you get it, if you get exposed by support, if there's someone who's really sick and you get exposed, your likelihood of dying is like high.
Which
and is it,
again is crazy because that's different from COVID, where
yeah,
large scale death, over 1 million people by, I think I was just actually at a health conference a few days ago where we were talking about it, and
but like a
not the
lot of
same.
people are getting very sick and a very small percent are dying. Whereas Ebola, not that many people are getting sick, but the likelihood of dying is very high. And it's like a very awful, painful, experience that, again, if you're not getting, treated, it is very, it's exposing the rest of the community. Yeah. And so like we were, I guess, blessed to know that leadership in Liberia and know all those people that were like so dedicated to addressing it, but they needed help, and we're also lucky that our leadership in Liberia, there was this guy, Pete, who was, had kind of been an emergency response person and then decided to kind of take on this water program as like a little bit like I kind of want to relax from the emergency stuff, which he'd been doing an amazing job, but like knew how to switch, like how to speak emergency, how to operate at that emergency level. And then we had also hired this lady, Pia, who was this amazing emergency response lady at the DC, at the kind of headquarters point. And so we created this kind of triumvirate of people who like understood the urgency, understood that we had this opportunity, that we understood how Liberia worked like well enough and could actually like make a difference.
Yeah.
And so we definitely had to shift the organization into this emergency response mode. And it was, a big deal, very scary for everyone. I remember coming back and just going, again, this was pre-COVID, so it wasn't a lot of remote work. So I was like, I still got to go back into the office, and everyone being like, I don't think we want you in the office. And just having to deal with that kind of thing, as an organization was a lot. But the big piece was just like shifting this like kind of normal development program that was trying to deliver water and toilets to this like massive response. And what it became, the main kind of response vehicle outside of the treatment units. There were these like treatment units, like if you got sick, they had doctors, they were trying to build these things, but we were really focused on the preventative side. So like somebody dies, are they getting buried safely? Our community members understanding that like if somebody is sick and dies, that you have to be very careful about how you treat them. You have to get them to the treatment unit. If they die, like they can't touch them. And in Liberia, they're like, they are like everybody else, have customs around how they treat people who die. And helping shift that thinking to understand that like you have these traditions that you have been doing for all of your recorded history, all of your, verbal history. And we have to shift that very quickly is a tall order. Like initially there were like radio jingles and stuff like that. And it's like, no, that's not going to work. We have to mobilize, the traditional leadership of the country to have in-person
To get people on board,
which is like, it's like, it makes a lot of intuitive sense. At the time, it's hard to say like, no, you have to have, these are intense conversations. It's serious. We can't just like have a radio announcement from the president. Like these rural tribal communities are not going to significantly change their behavior from a radio program.
No, I mean, it's like the U.S., and the U.S. Liberia is a small country. The U.S. is a massive country. And you think about, I'm just immediately picturing the need to, the people, I know people who primarily, or one of their main sources, like trusted sources of leadership and decision-making is maybe their pastor or their priest. A large portion of the United States is Christian.
Yep. And so that's exactly what we had to do. Think about like who are these communities and like, what is their source of leadership? Is it there were some that were Muslim, so we had to reach out to the like major imams. Some, like many, were Christian, so we worked with the 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 different religious communities, and some were a bit more traditional, and so we were working with those like more the chiefs, and there was a chief of chiefs, and like just getting those people in cars driving around Liberia talking to communities was a huge part of it. But also just like the logistics were incredible. We had dozens of burial teams driving around Liberia. Anytime anybody died in rural Liberia, these burial teams would have to drive out to the middle of nowhere. These roads are horrendous. So you need four-wheel drive, real vehicles. You have one for the dead body, one for the team, and another to move the dead body, and then another that was just on cleaning. And they all had to wear the white PPE.
I was going to ask that. I'm picturing myself being the driver of the cart with the body in it, and I'm like, I assume it's hazmat suits.
Hazmat suits. We had to retrofit the vehicle to be able to prevent, because you really had to protect the driver from the body.
Right.
And then we had to, in Monrovia, in the capital, they didn't have places to bury the dead at that rate of death. And so there were some riots. The government moved from the riots at the cemetery. There was not really like a EPA certified type of cemetery, so it wasn't really safe to bury the dead there. They started cremating just because of the volume of people that were dying, which is really not a tradition in Liberia. And so people were very upset about that. And that meant that they were hiding their dead in order to prevent the burning. And so another big activity that we took on was just like establishing the National Cemetery of Liberia. And so very quickly we had to drive around and select that, and get it cleared and get safe burials. And it's still around today. They have an annual holiday where they decorate and celebrate at cemeteries, and like that's now like a major place for it.
And is that annual thing? Is that like an annual commemoration or sort of recognition of everyone, so many people dying from Ebola?
No, it's just like it preceded Ebola.
Okay.
But now, because they have this like national cemetery, it has become like a bit more of a space.
Okay.
It's kind of like Mexico's Dia de los Muertos. Like it's like just a day to remember lost family.
It's actually tomorrow.
I know. Yeah.
Right. Odd timing that we're talking about this now, but yeah.
Yeah, absolutely. But yeah, I think like for us, as we were entering into that period where it went from like a very small program to like within, I think like a month and a half, we went from, this teeny program to this massive effort that was just covering the whole country. That was probably like the most intense period of my life. And I was going in and out of Liberia, like mostly this was led by people that, Liberians that were doing all of the work, either government or supported by us. And then, a small team of Americans who were either living there or coming back. I mean, I still remember one of the, scariest moments for us was, on the phone with Pete, who was our country director there. And, this is like right when it is taking off and people out of control. And Pete's sick. And we are just like, Pia, who was my colleague, said that like all the color ran out of my face, and, he was having symptoms. Like turns out it was malaria, which like normally you do not want to get malaria, but it was like the only time we're like happy that it was malaria. It was like really hard to get treatment because all the hospitals were shut down. Pete ended up being fine, but it was a scary time, and just super intense. So I went in for a while to like to support Pete, to give Pete a break, to support that leadership. But we are like hearing from the White House regularly. We are trying to collect information about how is it going, right? Like, are we making a difference? And because we were doing the dead body management, we could like see the numbers of like, are the numbers going down or are they going up? And initially they were going up, and then we could finally see it going down. And once we started like sharing that data with people got really excited. And I remember like the White House said, "Oh, well, you guys are giving this information weekly. We'd like it daily." And we're like, that's not how this works. Like, we have people like, this is not a live dashboard. This is like, there's a dude who's like making phone calls and calling all these different groups every day to try and get the numbers. It's not a daily thing. And having to like relay that information back to the White House was like, not, kind of a scary moment for me. Having to decline that request. But I was also then, because I knew Liberia somewhat well, was in Liberia and in DC, I was experiencing the kind of threat of, maybe not being allowed back into the country. It was particularly concerning for me because my wife was pregnant with our first child. And so I really don't want to be like missing this event. But also realizing that I had this, opportunity to support and couldn't turn that down given the risks. It also meant that, there weren't that many people in my role of like going back and forth. And so I could do a lot to support government decision makers. So like meeting with with Congress, meeting with the White House to kind of explain the context of like, why is this happening? How are communities engaging with this stuff? How to interpret these things that they're reading. And so I ended up having like a very interesting role of like going everywhere from like, watching a burial happen and seeing how what's working and what's not working, supporting the logistics, and then all the way to meeting at the White House and like talking to White House officials about like how to make good decisions about how to support the response.
And if I recall correctly from that time, they started to shut down. I mean, even in the U.S., some of the didn't we shut down a few airports, or they were talking about doing it, or
there was a lot of talk about it. Yeah. And especially when I was there was like a big debate about should we, and there were some nurses that came back, and were exposed and became pretty high profile. And I was trying to not be high profile. I was trying to like, make it to the birth of my child. Like, can I get to Thanksgiving? And ended up having like a bunch of reporters that were really interested in my story and wanting to like follow me around and see what was going on, which I was like kind of okay with, but also didn't, I didn't want to become a national story. And like, I didn't want there to be a national debate about like whether I should be able to go to Thanksgiving or not. And it wasn't like out of the realm of possibility that could happen. So I was a little nervous about that. But then, it worked, like, we were able to convince community members for the most part to, to change their behavior for this temporary period. And we could really chart the reduction in Ebola cases and in deaths. And so that was, once you could like see the line start to go down, people started to say like, okay, we've got a path here. This is going to be possible. We can process this. And then things really shifted to like, okay, we can take a breath and like, let's make like a medium term plan here. And that felt a lot nicer. Yeah, that initial period where it was only theoretical that the numbers are going to start going down. That was definitely more scary.
Yeah. And again, my closest, or my most relatable, not relatable, my most similar kind of experience was going into Haiti a couple of days after the earthquake in 2010. I was on the first team that went to stand up one of the main longer term recovery project that was clearing rubble, moving people who were unhoused and had set up tent camps in the different urban parks. The project eventually cleared all of those out and put people back into housing, et cetera. It wasn't the fear was an aftershock and more buildings falling down and me being in one of them. But there's some things you said that kind of is taking me back to that. I had this odd, I don't think this applies to you, but knowing that you don't have a big ego, maybe it does. I don't know. I remember thinking that even though I was like the number 2 on this team, and so it involved directing and kind of filling in, but I wasn't. I mean, we had a guy, actually, I'm not going to throw his name out. Well, I'll throw his first name out there because you remember Brandon because he was in Afghanistan. So to this day, we still keep up because we got to know each other. We were on this team together. He was the one running around. He found the last 4 dump trucks in Haiti, for example. There was only 4 left available. He got them mobilized to start clearing rubble and put people to work to do. He did those very specific, tangible things. Whereas I was, like I said, I was kind of doing a jack of all trades type of role. And one of the things that I had a really hard time with is during and after, I thought I didn't do enough. I was like, couldn't I have been doing more there? Couldn't I have made something happen faster? Am I really, and I'm not, I'm not assuming that you dealt with that. I'm just curious and maybe it's not that you had that kind of feeling, but what was did you have any kind of surprising emotional or, reaction, or were there certain things that you found certain times when you felt you were afraid of something and you were surprised by it? I just find these kinds of.
No, I mean, I think there were like a bunch of, first of all, there was like, this is really scary, but also we're stuck in this situation that like, there aren't a lot of other options than us doing this thing, and like, it's scary for everybody. And, we are really going to make the response worse by not taking a deep breath and like doing this thing. And so I think that was a big, and just like a real commitment to action. And I bet you had that with Haiti. Like we definitely had it like all the way up and down the line that everyone is just like completely committed to doing what needs to get done. And so like very frequently it was like, okay, well, we don't have approval for this thing because it takes like X number of weeks for the contracts to get like signed or whatever. But like we're clearly going to do this thing,
That's
while we wait for that.
Exactly what we did.
And we have like complete confidence that our partners in the government are not going to leave us holding the bag. Like there aren't like good contractual mechanisms that like understand like what it's like to operate during an Ebola crisis, but we have enough trust with like all of our partners, like in the United States and in Liberia, that like we're all going to commit to doing the right thing, and then we're going to have to like sort out, the paperwork later. But that commitment to like we're doing this, like we are going to do the right thing, and we're going to bust down every door to make sure that thing happens. Like I remember having to call like Toyota headquarters and just say like, I need all of your hardtop vehicles. These are these kind of like classic, super chunky, really good 4-wheel drive vehicles. They don't actually like, they're in the movies, but like they don't actually make that many of them any given, like they don't have a big stockpile at any given time. And I'm just like, I need to know where all of them are and how quickly they can get to Liberia, because I need to make ambulances, and I need a lot of ambulances, and I need to get them there in like weeks. So like, who am I talking to at Toyota HQ that can help me sort this problem out? Like a very weird conversation to have for me and probably for them. But
that was like a cold call, right? Probably just pick the phone up and say,
total cold call.
I'm in Liberia, trying to prevent a global pandemic and mass death. I just wanted to see who there might be able to help me identify the location. I'm just picturing the conversation.
Our mechanics only know how to work on Toyotas, and we need ones that have really good 4-wheel drive, because we had like these roads are terrible. So if I get them a Ford, I'm going to get yelled at. So I need like Toyotas and I need to get them now. It's and then hanging up and saying, well, I'm never going to have that conversation again. That is a weird one. That's one for the books. But
And you
yeah, I
got
mean,
you got
that total commitment, from everyone, that was like what was really unique. Normally everyone has like slightly different, things that they're trying to achieve. You're like talking to the construction company about building the cemetery, clearing the land for the cemetery. And normally it's like, okay, well, what are these guys trying to pull over on me? And we're just like, no, we're clear. Like this thing has to happen tomorrow. So like we can align, and people are dying. You can get like much more aligned with people quickly during these emergencies.
and that was very much my
Like I'm sure
experience.
people are not like, now's my chance to like, pull one over and like, get a little bit of an edge here. I'm just like fully committed.
So I always try to go back to this question, right? I think in this case, for me at least, it seems obvious that paying for this and for the United States being so involved, because I mean, it was the American, it was us leading all of this for all intents and purposes. Like,
Well, yeah, with the government, but yeah, it was really
with the
like
government. I
American.
meant as in terms of
they kind of
outside
they
help.
split up. Like the British took Sierra Leone, the French took Guinea, and we took and I think like people probably forget that like there was a lot of concern that this was going to expand significantly outside of West Africa. And there were some cases that like came to the United States, and that got everyone really freaked out. And there was like a real concern that this would just like expand out. And it's like nice that it didn't. I mean, it was still really bad. Like still thousands and thousands. Over 4,000 people died, but it could have gotten could have gotten a lot worse.
And couldn't it? It could have gotten a lot worse, meaning, I mean, it's like, unfortunately, it was like COVID, where if somehow it had gotten contained to one area or region and really they had quarantined that properly, we wouldn't have seen that multiplier effect, because that's what happens, right? With an outbreak is you go from 4,000 to 10,000 to 100,000, and it's completely gone off the rails. And I think, from what I understand, COVID is a lot more easily transmittable and contagious.
Way more contagious. Yeah.
So they're not directly comparable, but
the rate, it's like more contagious in terms of like spreading through the air, but the likelihood of getting it is much higher if you're exposed to Ebola, and then the likelihood of dying. So it is like easier, it is faster to kind of burn out, because of how deadly it is. Whereas COVID, you can like people can get sick and they can continue to spread and spread and spread before even like feeling symptoms, let alone like actually having, the, people passing away. So it's a much like faster spread and like much faster, but also like faster kind of like, impacts as well.
And so I'll ask the almost like offensively obvious question, but I'm still going to ask it, right? Why did it matter to do that for Americans and for people for Americans? Why did it matter? Why did we do that? Why did we invest in or spend the money on containing it?
Yeah. I mean, I think like not having Ebola in the United States is nice.
It is. Yeah.
It's pretty good. Not having West Africa devastated by Ebola is also good. That would be problematic for us as like from a national security point of view in a variety of ways. And so that also, like, I think there's like a political and national security piece around like having reasonable stability in West Africa, which is like a massive region with lots of people. But I think like not having Ebola like spread through the world is like a pretty good thing. So, I think that, and that was clear. I think like, those who paid attention and lived through 2014, that people were pretty freaked out about that, and pretty concerned. And that took over the airwaves for quite a while. And so I think like it's good to remember that the United States actually like did something about it and was able to actually help support it and like
Yeah, sure.
prevent that from happening. Like it's possible to like take a deep breath, make the investments. And it wasn't, I mean, this was not a lot of money at all. You know, like tens of millions of dollars that were like actually like driving most of the impact um to, you know, to prevent an outbreak in, you know, in the United States is easy. I think like the upgrades that they had to make in the hospitals just like in case Ebola came was like way more than how much we actually like spent in West Africa.
That's interesting, actually. That's very interesting.
I mean, if you think about it, I mean, because they were really doing a lot to set up emergency treatment units and like support, not emergency treatment units, but like I forget what the terminology is, but you know, the ability to treat Ebola patients in the United States, like in preparation. And like that was all, it was, those are really costly to set up in the United States by our standards. Yeah, I mean, I had to go to like a birthing class, like, you know, get ready to have a new baby class, and had to like, you know, they had like a thing that was like, has anyone been to West Africa in the last 30 days? And I had to be like, oh, actually, I am. And they were not happy to have like, they were like, no one has ever answered that question affirmatively. We don't even know what to do when someone says yes to this. And so it like delayed the class by like an hour. I had to wear PPE at the class. Everyone's just like staring at me. And it's just like, you know, this is what happens when you have a new baby, and this is what the hospital, you know, what the,
Yeah. Yeah.
it's like, you know, if you think about how much the public health system was just mobilized in the United States to get ready for that, it was, you know, really expensive, let alone like actually having to do it.
You know, it's interesting. Oh, and actually, just so we can make sure to, I think, share the happy ending. You were back in time for was it your
Made it.
daughter's? Yeah,
Yep.
back in time for yeah, which is great. But it's interesting that we're talking about this right now. And I mentioned a little while ago that I was at it was actually a pandemic and public health preparedness, a summit at Texas A&M University, and spoke on one of the panels. And one of the topic I was covering was actually public education and public awareness, because there are a lot of people, and I understand why someone could think this way when everyone's concerned about taxpayer waste and being government inefficiency, and how do we mitigate that kind of thing. And I get that. I'm not actually a big proponent of heavy government spending, just for, I get that, actually. But one of the topics, and these were some folks who were dealing with these issues of vaccines and medicines and stockpiling, and how you prepare for a crisis, how you prepare for an outbreak. PPE, personal protective equipment, is PPEs, right? So when you said that a second ago, I wouldn't have known. I had to ask that question because this isn't really my sector, but my area. But talked a lot about that and stockpiling that, and the people in the state of Texas who are responsible for managing that, and sometimes it's an uphill fight for them to continue to get funded, because people say, well, what's the ROI? What's the return on investment to be prepared for a pandemic, to be prepared for a public health crisis, to prevent one, right? And it was really interesting. One of the analogies I really liked was, well, if we measured the effectiveness and value of our fire departments based on return on investment, we would shut them all down, because you're not. I mean, their job is to put out fires and respond to emergencies and do EMT work in some cases, right? Well, you hope there aren't very many of those, but I mean, yeah, the people, firefighters, are sitting around the fire station around the clock. I don't want to shut the fire stations down, right? We have to have those. I don't think anybody would really disagree with that. So
Yeah.
I think
No, and I think about how much we spent on COVID, mitigants in response, like as a nation, right? Like between individuals and insurance companies, and then just like the amount of support that the US government had to provide to people during that COVID period of, that was a crazy amount of money. And not having to spend that would have been really nice. The US government not having to take on that much debt to be able to provide that support to everyone while the pandemic raged and the COVID pandemic raged. That would have been real nice. And if we could have spent a little bit on prevention, not to say that we could have in the case of COVID, but like, I think that is the risk. Like if a pandemic really takes off, the costs become like astronomical. So how do you kind of guess at the likelihood of that? And like, I think that's the real value of, pandemic prevention.
Pandemic prevention, for me, it's the investment in, we have to spend some money for prevention. We have to spend money on things like early warning systems that wherever we can use them. In the case of COVID, since it likely came out of China, there was no U.S. aid in China, right? And actually on that subject, this was what you were doing you weren't directly working for U.S. aid. You were with an NGO, was funding, at least some of the funding was coming from U.S. aid to do all the prevention. So you can't stop a disease outbreak. You can't stop a disease from coming to the U.S. at the border, right? You have to stop it at the source. That's kind of the fundamental 101 prevention rule, right? Now that we don't have a U.S. aid anymore, I'm worried about, actually, I think we should all be pretty worried about this, but what do you, and I assume you agree, you were, again, tip of the spear dealing with this, but.
Yeah. I mean, I think it just puts us all at risk that, we won't be able to catch it early. We had teams in it, it kind of started in northwestern Liberia, and we had, there was a whole community of public health workers that were able to very quickly see what was going on and get there, because they were already kind of like deployed and in Liberia. And it wasn't like a big team. It was just a couple of people, but they could be like, hey, there's like something going on here and we got to get ahead of it. Not having that and letting it get way out of control. That the idea of that is like pretty scary.
It's scary.
Yeah.
On that note, is there anything else you wanted to add about kind of your experience? And
no, I mean, I think like in terms of, you were asking about emotion. The other emotion I have is that it's weird to talk about this without my colleagues. They're all, doing the work and just getting the support. Like all of the people doing the burials and the driving the ambulances were Liberians. It's not easy to just like be a poor country and all of a sudden need to spend a crazy amount of money on fuel and vehicles and all this stuff. Like that's like, they don't have the infrastructure for that. So they need that support and training, like figuring out how to get like a high quality Ebola training as like, that's just like, there's only a couple of those experts. Like you need help to like get that all sorted out. But it's hard for me to like talk about this as like that I was the tip of the spear, when I think like they were the tip of the spear and I was just like supporting them and being like, doing everything that I could to like get them what they needed. I also want to say like they were all safe. We didn't have any cases of all of those burial teams and all of those ambulance drivers. And we're really proud of that. But that I think was like, that's the other challenge that I have talking about these things, is that like, there's a bunch of people in Liberia that I would be like, oh no, that's, they might not have a good internet connection. They might be a bit hard to understand, but like they were the heroes that we were supporting.
Yeah. That's the idea, is I'm trying to draw attention to the people who are unsung. That's it. So I appreciate the sentiment and the point very much. Brett, I thank you very much for sharing all this. Thank you for helping prevent Ebola from spreading to the United States. And I'm glad you got back in time for your daughter's birth. And yeah, thanks again for joining us today. That's it. Everyone, thanks a lot for listening all the way through. Once again, please like, share, and subscribe, and we'll see you next time. Thanks.